the new reality.
Hi, Grandma.
You thought you were going to die.
Yeah, I thought I was going to die.
Caregivers struggling to contain the spread.
We was getting mixed messages.
Devastated families on the outside looking in.
I knew Mom not seeing me, she'd be worried.
While the virus ran wild.
It just seemed that nobody knew what they were doing.
How was COVID-19 able to spread so viciously in this long-term care home?
Are care homes better prepared for this second wave?
What really is concerning is that it's almost like they didn't actually really learn the lessons that the rest of us learned the hard way.
Hello, I'm Donna Friesen. Canadians have been living with COVID-19 and dying from it for more than 9 months now. And yet, lessons learned in the first wave are not being evenly applied in this second wave, especially in some long-term care homes. About 80% of the deaths from COVID-19 in Canada have been residents in long-term care. Despite all the rhetoric from political leaders, including from Ontario's Premier, about protecting the most vulnerable, in November of 2020, there are around 160 outbreaks in Ontario long-term care homes, retirement homes, and nursing homes. Our care homes and their residents and staff continue to be this pandemic's greatest victims. Why haven't lessons been learned? Tonight, Farah Nasser has an exclusive look at what went on inside one Ontario care home this spring, what staff, residents, and families were being told, and what they weren't.
This is Markhaven Home for Seniors, a non-profit, government-funded, long-term care facility in the Toronto suburb of Markham. 17 residents died of COVID-19 here during the first wave, and dozens more were infected. It's a scene that played out at hundreds of seniors' homes across Canada. Caregivers struggling to contain the spread, devastated families on the outside looking in, while the virus ran wild, killing thousands of residents. Markhaven looks calm now, this lonely sign of condolence flapping in the breeze, the only visual reminder of the tragedy that played out this spring. But to those who worked in the industry, the warning signs were there.
In this field, you're always short. You know, could have do with more staff, especially in the COVID time. But we work with what we had.
Maggie Gittins worked as a PSW at Markhaven for 30 years until she got the virus in late March. She was hospitalized for more than a month and nearly died.
She wasn't the same when she came from the hospital. She was having terrifying nightmares. She can't sleep.
I can't sleep without sleeping pills. It's hard because I'm a person that always on the go, always doing something, and now I have to sit down home and depend on my kids to do mostly everything for me because I had to learn to walk. I had to learn to swallow. It's very hard.
So, how was COVID-19 able to spread so viciously in this long-term care home? We have some answers from internal documents obtained exclusively by Global News. They reveal new details about what was unfolding behind the scenes at Markhaven between management and regional public health authorities. It started on March 12th when a resident came down with a cough and fever, but it was a full 5 days later before a Markhaven nurse identified only as Yan finally called and reported it to York Region Public Health. By that time, 5 more residents were showing symptoms. On March 20th, a 74-year-old resident tested positive, and health officials declared a COVID-19 outbreak.
Did you give care to that first patient?
Was my assignment. I thought, my goodness, we should be wearing everything, and she should be maybe in hospital.
Maggie was dealing with an infected resident while caring for other patients at the same time, and she was concerned she wasn't wearing the right gear.
I had on this stuff, but you're wearing this,
Was it this kind of a mask or was
Yes.
it an N95? It was this kind of a mask.
This, yes.
It wasn't a medical grade mask.
This. As a result of that, I almost lost my life.
That night, Markhaven Executive Director Mike Bakewell sent an email to the family members of residents, reassuring them Markhaven was working closely with health authorities and following correct protocols to contain the spread. But the following afternoon, Bakewell sent a long, scathing email to health officials explaining they were dealing with a chaotic and stressful situation. Their supply of personal protective equipment was dwindling, and he was dealing with staff abandoning their posts. He complained of conflicting information coming from the government about where to get PPE and what kind of mask to use, claiming he was fighting tooth and nail to keep staff in the building, and public health, he said, wasn't being helpful. The chaos and confusion behind the scenes was playing out on the front lines, and staff were getting very worried.
We was getting mixed messages, if I could put it that way. 1 minute you're told you're not supposed to do this, 1 minute you're told you do this, so you don't know which way you're going.
We were asking, do you guys have masks? Are you guys wearing your masks? And at that point, my mom said no. So we're like, you have to demand it, and you have to demand the proper PPE. You guys have to get the N95 mask, but they never got it.
It was like panic inside, but you can't show you're panicking. And as I said, you're trying to be as comfortable, try to do your work the best way you can.
If workers were getting anxious, so were the families. For Chloe Eftivolos, it was a slow burn. Her mother, Lulu Travalos, had been at Markhaven for years. She'd gone through the occasional lockdown for outbreaks of flu, but it wasn't long before Chloe realized this was different.
So the first instinct was, okay, I'll wait a week. And then it was 2 weeks, and then I was really anxious because I knew Mom not seeing me, she'd be worried.
Chloe said she'd noticed staffing shortages in the past, but her mother was blind, deaf, and had dementia. With the home locked down, she had no idea how bad things were getting. Staff didn't feel safe working at Markhaven because they didn't have proper equipment, they didn't have enough workers. Did you know any of that?
No. I'm surprised to hear that. Yeah. I thought they were well equipped.
By March 22nd, health officials had told Markhaven to stop staff from working at multiple homes to contain the spread. But in an email to Public Health, Executive Director Mike Bakewell said nearby facilities that shared staff with Markhaven hadn't received any directive on this, and other homes will not turn them away unless they receive this direction from you. The very next day, Markhaven got word its first staff member had tested positive and had been working at another home. In British Columbia, Chief Public Health Officer Dr. Bonnie Henry issued an order banning long-term care workers from working at more than one facility on March 26th.
Healthcare workers are able to work at one facility only.
But it was nearly 3 weeks before Ontario's Minister of Long-Term Care did the same. Asked why the delay, the minister and the province's top doctor pointed the finger at each other.
We rely on the advice and recommendations and directives of the Chief Medical Officer of Health.
I was not privy to how all the mechanics of that was between the Minister of Long-Term Care as well as with the Minister of Labour and with the Cabinet to deal with those issues as it is an emergency order.
Time after time, documents reveal frustration and lack of cooperation between Markhaven and health authorities. On March 29th, York Region Public Health asked Markhaven for a list of personnel who had gone in and out of the home for contact tracing. It was the third such request. The first was more than a week earlier. But according to notes taken by a public health officer, Director of Care Kevin McKay said it would take him a few days because there was only him alone, no office admin staff. More than 2,000 Ontarians have died in long-term care. That's over 10 times more than in British Columbia. We wanted to ask York Region Public Health and Minister Fullerton why, but both declined our request for an interview.
Well, I think that the picture that the documents paint really is a system which was totally unprepared for the pandemic. And it just seemed that nobody, knew what they were doing.
Jane Meadis is a lawyer and longtime seniors advocate.
It was very clear very early on, and it's obvious in the documents, that the homes were not properly trained, didn't have the right kind of infection control protocols that they should have had in place.
Whatever protocols were in place at Markhaven were clearly failing. By 7:15 on the night of March 29th, Director of Care Kevin McKay called to inform public health that the first resident had died. 68-year-old Linda Jean Duncan, a mother and grandmother of 3 children. Just 1 hour later, and McKay was on the phone again, telling public health another resident was dead and requesting more death certificates.
And did you find out about the other patients who had passed away? Like if any of your, were they any of your people, your residents that you saw regularly?
Yes. Yes.
3 days later, there were more than a dozen residents and staff infected, and Maggie Gittens was in the hospital. After caring for the first resident infected, she had the virus too. And all of a sudden, she was in trouble.
You thought you were going to die?
Yeah, I thought I was going to die. I was coughing so bad that I couldn't talk.
What happened to you in the hospital?
I don't know.
She really doesn't
I don't
remember.
know. I know I went to the hospital.
She didn't know what happened next because almost immediately, she was in intensive care, unconscious.
Oh my God, it was nerve-wracking. It was every day, like, we didn't sleep at night. It was hard, you know, it's scary, it's terrifying. It's a new virus we don't know. So my mom's 60 years old, she has diabetes, she has high blood pressure, she has high cholesterol, heart problems.
Hi, Grandma.
As time passed, hospital staff set up video calls so her family could talk to Maggie. They were praying for any sign of life.
Pull through, you can do it. It was hard seeing my mom, like in a coma, basically. She was in a medically induced coma. She was on the ventilator for 17 days. And then by I believe it was day 18, I got a FaceTime. And when I answered, it was my mom and she was off the ventilator. And like, we just burst into tears, couldn't believe it. It was like the best day of my life. We were so happy.
As happy as that moment was, more than 6 months later, Maggie is still feeling the effects.
It's scary for me, you know, to go outside, to go anywhere, to go in the store, to go somewhere where you have people. It's the hardest thing to do now, especially with the second wave. And people is not taking it seriously.
While Maggie was in hospital fighting for her life, Chloe Eftivalos was in mourning after the virus took her mother's life.
What do you remember about the day that your mom got the virus, that you were informed that your mom had COVID?
Then the next phone call was, I'm sorry, I'm telling you that she has got the virus. She has proved positive. 3 days later, she was gone. That was it. That broke my heart because I always knew I'd be with my mother at the end. I mean, that's what we do. And I couldn't be there for my mother. You have no idea the guilt that I have for that.
But you know it wasn't your fault.
I know, that's what they tell me, but it's hard. It's hard, it'll take time.
In a little more than 2 months, 17 of Markhaven's 96 residents were dead. The question remains, why did so many Ontario seniors die in long-term care?
We have to do a better job. And at the end of the day, the buck stops with me.
Ontario's government didn't act to support long-term care homes desperate for staffing reinforcements until April 22nd, more than a month after the first confirmed case at Markhaven.
Today, we'll be making a formal request to bring in those extra reinforcements. This includes resources from Public Health Agency of Canada and Canadian Forces personnel.
Ontario requested soldiers to help stabilize the province's 5 hardest hit homes. Markhaven didn't make that list. And meanwhile, The political finger-pointing continued.
We have been taking the advice of the best experts, our medical and scientific experts on this.
I give them the best advice I can, but we need the power and authority of the minister, as well as the ministry and the premier, to back up those with resources and materials so we can get on and get the task done.
Markhaven's outbreak was finally declared over on May 16th, but trust had been shattered.
We're so mad at Markhaven. My brother, my sisters, and I were just so upset with the way things played out and the reason why my mom is the way that she is now. It's so upsetting.
Markhaven is one of many long-term care homes named in class action lawsuits. We requested an on-camera interview with the executive director, but he declined on the advice of lawyers. In an email, Mike Bakewell claimed they strictly followed public health guidelines and praised the efforts of their staff during the outbreak. Many of those employees were traumatized and won't be going back to work. Maggie Gittins may never fully recover, but she knows better than most how vulnerable long-term care residents and staff are. She just has one simple request.
Treat us like a human being. You know, we are the one who is here taking care of your loved ones. Treat us with respect.
Coming up on The New Reality.
When it was becoming clear that 80% of Canadians who died in this pandemic were living in our long-term care homes, we had all of our provincial and federal leaders coming out saying the system is broken, but fixing it means billions of dollars of investment.
Welcome back. You'd think we would have learned more by now, yet at some long-term care facilities across Canada, there is an alarming rise in COVID-19 cases and deaths. It feels like patterns we saw in the spring are repeating now. What needs to happen to stop this catastrophic trend? Dr. Samir Sinha is one of the leading authorities on caring for the elderly. He is the Director of Geriatrics at Sinai Health in Toronto. We're now in a second wave across Canada. There's out-of-control community spread happening in places like Toronto and Manitoba. Are care homes better prepared for this second wave?
We haven't seen the same degree of outbreaks, and I think that reflects the fact that homes now have access to PPE. They now have staff that are not working between multiple settings, for example. But what really is concerning is that we're still seeing that with a lack of staffing and with other issues in terms of the levels of community spread, that these homes continue to remain vulnerable. And we are certainly seeing a number of homes across the country that are having spectacular outbreaks that were representing that within many homes there are weaknesses that still exist that we haven't been able to rectify between the first and second waves.
Is it that the underlying issue in society and the healthcare system doesn't value residents in long-term care because they are seen as being close to death?
Well, I think this is a huge issue because when you actually say, well, why did long-term care homes in Canada, why were they so devastated compared to other countries? Well, the fact is when we compare ourselves to other rich industrialized countries, Canada spends about a third less on its long-term care systems than other countries do. So because we spend a lot less right off the bat, it means that we have less staffing available in our homes to deliver the care that's actually needed. And we also have poor quality facilities. Both of these were major factors that set our homes up to fail. I think the other thing that concerns me is that we have Manitoba, for example, that's currently going through its first wave, if you will, and they actually had the opportunity to witness what happened in the rest of Canada. But what really pains me is actually to see that, you know, they're saying, well, hindsight's 2020, and we didn't realize it could get this bad, or these outbreaks could occur in such a significant way. And it's almost like they didn't actually really learn the lessons that the rest of us learned the hard way.
Back in the spring, there was a long delay, I think about 3 weeks, between when BC ordered personal support workers must only work in one home and when that same order was given in Ontario. It seems so basic in hindsight. Why do you think it didn't happen right across the country right away?
What we do know is that in a fast-moving pandemic, you know, speed actually matters, and making decisions in a timely way will actually save lives. So I don't know what the disconnect is and why so much delays have actually taken place in implementing clear science-based evidence But what we do know is that the provinces that continue to delay implementing the right policies and recommendations are seeing way more deaths that are absolutely preventable.
Ontario Premier Doug Ford has said he is genuinely heartbroken by all the deaths in long-term care. And we know his own mother-in-law lives in a care home and she caught COVID-19. It's not that governments and politicians don't get it. So why has the system failed people so badly?
You know, the challenge is that when it was becoming clear that 80% of Canadians who died in this pandemic were living in our long-term care homes, we had all of our provincial and federal leaders coming out saying the system is broken, we're going to fix it, and we'll do what it takes. But fixing it means billions of dollars of investment, because right now in Ontario, we're providing the average resident with about 2.7 hours of care every day, when our own government's expert advisors say it should be 4 hours. So this is where we then need to put an investment in, but governments have been dragging their feet. And we just saw that in the recent Ontario budget. Right before the budget announcement, they made a deliberate point to actually say we are going to meet that standard of 4 hours of care a day, which would come with a $1.6 billion price tag, but they said it would come by 2024-25. And then I think what really upset families and many advocates like myself was to see that in the budget that came out a few days later, there was no money to be seen, even though the Premier reiterated that we are committed and that we will find the money when it's necessary. Well, it's necessary now.
Next week on The New Reality.
Was never, ever planned in Halton here to have a CN intermodal facility in this community.
With trucks, like in terms of like the exhaust fumes that are going to be bringing, like all like the carcinogens and things like that, they're probably going to be bringing in, and I don't want to be breathing that in. I don't want my kids breathing it in.
You can't have, you know, kids on their tricycles, on their bikes, families driving with 1,600 trucks on the road. This can happen anywhere across Canada, and it shouldn't be allowed. It's not right.
It's the wrong terminal in the wrong place at the wrong time. And I just feel that CN is, pardon the expression, railroading this one through.
All that and more next Saturday on The New Reality. I'm Donna Friesen. Thanks for watching.